Welcome to this training on safeguarding in health and social care. By the end of the training, you will know how to recognize signs of abuse and improper treatment. You will know how to respond to suspected or disclosed abuse and improper treatment. You will understand the national and local context of safeguarding and protection from abuse. You will understand ways to reduce the likelihood of abuse or neglect. You will know how to recognize and report unsafe practices. You will understand the principles of safeguarding adults and understand the principles of online safety. Safeguarding refers to the measures taken to protect the health, well-being, and human rights of individuals, particularly children and vulnerable adults, to ensure they live free from abuse, harm, and neglect. Safeguarding is crucial in various settings, such as schools, workplaces, healthcare, and the community, to ensure the safety and well-being of vulnerable individuals. Now that we know why it is important, what is safeguarding then? The Care Act statutory guidance defines adult safeguarding as protecting an adult's right to live in safety, free from abuse and neglect. It is about people and organizations working together to prevent and stop both the risks and experience of abuse or neglect, while at the same time making sure that the adult's well-being is promoted, including, where appropriate, having regard to their views, wishes, feelings, and beliefs in deciding on any action. What is harm? Harm is any conduct or behavior that causes physical or psychological pain, injury, or death to a person. What is restrictive practice? It includes the implementation and procedures that restricts an individual's movement, liberty, and freedom to act independently without consequence. It includes practices such as seclusion, sedation, and physical restraint. What is abuse? Abuse is when someone causes us harm or distress. It can take many forms, ranging from disrespect to causing someone physical or mental pain. It can occur in someone's home, a care home, a hospital, or a public place. Often the people who commit abuse are taking advantage of a special relationship. There are different types of abuse. In summary, they include physical abuse, which includes hitting, slapping, pushing an individual, or the misuse of medication. Emotional abuse involves the use of threats, humiliation, intimidation, or the isolation of an individual. Sexual abuse is another form which includes forcing or enticing a child or vulnerable adult to take part in sexual activities. Neglect is a form that includes failure to meet the basic needs of an individual, such as providing food, clothing, or medical care. Financial abuse is another form, which is the illegal or unauthorized use of someone's property, money, or assets. Discriminatory abuse includes the use of harassment due to an individual's race, gender, age, disability, or sexual orientation. And we have institutional abuse, which includes poor practices in care homes or an organization generally. Self-neglect by the individual includes the failure to look after their personal health or their surroundings. And modern slavery involves the use of forced labor, human trafficking, and domestic servitude. So as a caregiver, in the context of safeguarding, what signs and indications should you look at for abuse? There are physical signs, behavioral signs, or environmental signs. Physical signs include bruises, fractures, burns on the individual's body, and signs of malnutrition. Behavioral signs include anxiety, the display of anxiety, depression, withdrawal, or sudden changes in the individual's behavior. Environmental signs include unsafe or unsanitary living conditions, the lack of personal belongings that the person should ordinarily have. There are 6 key principles of safeguarding. The first being empowerment, where we're supporting the individual to make their own decisions and giving their informed consent on issues that matter to them. The second is prevention, taking action before harm occurs. The third is proportionality, for the caregiver to ensure that responses to risks are appropriate to the level of that risk. Protection is the fourth principle, where we are supporting and representing those in greatest need. Partnership, the fifth principle, working together with local authorities and organizations. And lastly, the sixth, accountability, ensuring transparency in safeguarding practices. The 6 principles of safeguarding have been enshrined into law and are in the Care Act 2014. They form the 6 principles of the Care Act. Empowerment. To reiterate, these are person-led decisions and the need for informed consent. Prevention. It is better to take action before harm occurs. We're repeating what we said regarding safeguarding, but it is important to emphasize. Proportionality. To take the appropriate proportional action, the least intrusive response as appropriate to the risk presented. Protection. To support and represent those that are in need. Partnership, working with local organizations, finding local solutions, working together to have better communities. And accountability, so that there is transparency in the delivery of safeguarding services. There are some factors that contribute to an individual being more vulnerable to abuse, and they include age of the individual, either being young or old, issues relating to learning disability or physical disability, mental ill health issues such as dementia as well, and people who require care and support from others are also more vulnerable to being abused. It is a known fact that perpetrators can be very good at hiding the violence publicly by presenting a kind, loving, charming, and likable behavior, but behaving in cruel, violent, undermining, and manipulative ways in private. Some of the common tactics used by perpetrators to coerce and control victims are in the next slide. Some of the tactics used by the perpetrators to control the victim includes intimidation and threats, by causing fear, destroying the property, the way they look at them, or even hurting their pets, things they love. It includes undermining their confidence by damaging their self-esteem through humiliation, ridicule, and shaming them. Having intentional behaviors that make the victim doubt herself, in this case, a woman. Using the children, for example, by telling the victim that she's a bad mother. Using access to harass or assault her and threatening to take the children away. It may include coercing the victim to get pregnant, threatening to harm the children, and engage in risky behavior with them. And in some cases, making the child or children watch or participate in the abuse. As a caregiver, then, what actions should you take if you suspect an individual is being abused? It is important for you to protect the individual, keep them safe and protected. You must report the abusive situation immediately to your line manager or the appropriate person. You must preserve the evidence. It is a potential crime scene. Do not clear up, do not wash or clean any part of the room or area. Keep other people out of that room or area. And it is also important that you report and refer You must record the abuse accurately, legibly, and completely. Remember, it is now a legal document. In a situation where an individual alleges that they are being abused, it is important that you take the following action. You must treat all allegations seriously. You must not ask any leading questions. You must listen to what the person has to say, actively listen to what they have to say. Record the allegations accurately using the person's words. Maintain confidentiality of the information being provided to you. Make sure they're in a safe place. Reassure the individual that the correct steps will be taken by following the policies and procedures of your organization. Inform the individual that you are obliged to let the appropriate people aware of the situation. Report the allegation immediately to your line manager or the appropriate person. In order for you to ensure that the evidence of the abuse is preserved, it is important for you to record it. Record all the physical injuries, for example, the body map and photographs. Do not remove any beddings. Do not wash or clean any part of the room or the area in which the alleged abuse took place. Do not remove any clothing that the abused person is wearing. Do not allow the person to wash, shower, bathe, brush their hair, or clean their teeth. And it is also important to keep other people out of that room or area, as it is a potential crime scene. There are also national policies and local systems that relate to safeguarding and protection from abuse. These include the Local Safeguarding Adults Board, which helps to safeguard adults with care and support needs, and the Care Act 2014 aims to ensure the well-being of people in need of care and support services. It aims to bring about the personalization of care services, putting the person at the center of the process. Another very important legislation is the Mental Capacity Act 2019, which aims to protect the rights of people who may not be able to make their own decisions due to factors which impair their mental state. This may include stroke, head injury, learning disability, mental illness, or intoxication. And there are 5 key principles that are taken into consideration. One is the presumption of mental capacity. The next is the right for the individuals to be supported to make their own decisions, either through advocates. The individual retains the right to make eccentric or unwise decisions. Some of us do that anyway. And the fourth principle is that all decisions should be made in the person's best interest. and we must use the least restrictive intervention in that process. There are quite a few laws that have been developed to complement the Safeguarding Adults Board policies and procedures. These stressed the importance for organizations to have clear, comprehensive safeguarding policies. It also sets out the roles of the Care Quality Commissions that oversees the compliance element of these organizations. I'd like you to pause the video at this point to research each legislation that have been listed on this slide so that you can better familiarize yourself with their requirements. There are also some national policies and local systems that relate to safeguarding and protection from abuse. Listed below are some of these policies and local systems. I'd like you to pause the video at this point and do your research to find out more about each one of them. Next, we have the prevent strategy. And the purpose of this is to stop people from becoming terrorists or supporting terrorism. And its aim is to reduce the risk of radicalization and terrorism as a whole. It aims to prevent people from being drawn into terrorism and ensure that they are given appropriate advice and support. Of course, this with the more vulnerable people in our societies, generally speaking. It aims to work with sectors and institutions where there are risks of radicalization that we need to address. Prevent is part of an existing safeguarding responsibilities for the health sector. It's not an additional responsibility. Healthcare workers have the opportunity to refer vulnerable individuals for support in a pre-criminal space by recognizing the vulnerable adults, children, and young people who may be at risk of radicalization. By working in partnership to reduce the risks and protect the individual from being radicalized, and also by providing adequate and necessary support as part of the proportionate multi-agency response to any concerns anyone may have regarding radicalization and the vulnerable people in those communities. Local authorities also have responsibilities. They have the Safeguarding Adults Board that is responsible for delivering a multi-agency response to safeguarding and the protection of individuals from abuse. The multi-agencies act on safeguarding issues at a strategic and an individual level. It consists of the social services, the voluntary centers, the police, care workers, and other care professionals. They have a named person overseeing the safeguarding assessments and its outcomes. The Independent Safeguarding Authority, the ISA, and the Care Quality Commission work together to safeguard children and vulnerable adults, and also are responsible to investigate safeguarding issues. There have been reports into some serious failures to support individuals from abuse in some care settings. An example is the Winterbourne View Hospital, where individuals were being abused by staff who are supposed to protect them from harm and danger. The issues came into light when BBC Panorama went undercover and led to the imprisonment of some staff and the closure of the hospital. This case wasn't unique. There are quite a few other cases that were brought to light over time. I'd like you to pause the video and research the cases listed on this slide: the Michael Gilbert Review, the Orchard View Serious Care Review, Stephen Hoskin, Margaret Pantin, and Victoria Clumby. So you can better familiarize yourself with why the laws have been changed to better safeguard the vulnerable people in our society and our care. Some of the factors featured in the reports of the serious cases of abuse include bad practice throughout the organization, poor staff recruitment, they were not being vetted properly, poor staff development, not being trained appropriately on a continuous basis, lack of effective communication between agencies, poor partnership working between various teams to cater for the needs of the people who are in their care. Other situations include whistleblowing policies and procedures not being followed for whatever reasons that there are to those individuals and their settings. There was a lack of person-centered approaches to the care being given, and there were no transparency, openness, and honesty. The duty of candor was not present in their practices. There are various sources of information and advice for a caregiver in relation to safeguarding and the protection of individuals from abuse. These sources include the safeguarding policies and procedures of the organization you work for. These are usually updated on a regular basis as at when required. Information can be gathered from the Care Quality Commission, from the care plans and support plans of the people that are being supported in the settings. Information can also be gathered from other healthcare professionals who may be your colleagues or have been in the sector for much longer than you have been and are more experienced, or other professionals who are part of the care team of the individual who is being supported. Information is available from the Social Care Institute of Excellence, from the internet or the intranet of the organization you work for. Other sources include your line manager and staff meetings, and also supervisory meetings when you have your appraisals and one-to-ones and coaching sessions so that you continuously improve your practice. There are ways to reduce the likelihood of abuse. And one of the ways is working with person-centered values, where the caregiver, the support worker, is aware of the individual's preferences and therefore is able to recognize any abnormal physical or behavioral changes that might indicate that there is harm or abuse. Another way is to encourage active participation. This enables the vulnerable adult to avoid social isolation, because abuse or harm is usually a secret activity and is unlikely to therefore happen if the person has a range of active social contacts. Another way is to promote choice and the rights of the person we support. This empowers them to take greater control of their own lives and care. Choice also means risks. So managing risk is a way of working with that individual to support them to exercise the choices and rights that they have by recognizing the balance between the risks presented and also the choices they can therefore make. It enables independence, choice, and control, and they can then make their own decisions and defend their choices. There are some unsafe practices that may affect the well-being of the people we support. This includes poor working practices, whereby we neglect the duty of personal care, for example. Another is inappropriate physical contact in relation to moving and handling. We need to be very careful and professional in our approach to this. Another is unsafe administration of medication, whereby the support worker is not checking the dosage or failing to check the dosage. And it's important to therefore check that error is not being made, which can become quite disastrous. Another is the unreliable systems that we can have in dealing with the individual's money and personal property. There could be failure to witness or record accurately the records of that person, their possessions. Another is the failure to update knowledge on safeguarding issues by not updating or reading the latest safeguarding policies and therefore not being trained adequately to be current with legislation. The misuse of authority is another malpractice whereby physical restraint may be used unnecessarily. Failure to maintain professional boundaries in relationships is also a cause for concern and unsafe practice. Failure to ensure supervision in lone working situations is another unsafe practice. Inappropriate communication or the sharing of information which can breach confidentiality is an unsafe practice. Will distract from the person we support wanting to be authentic and open. And it's an abuse of the Data Protection Act and GDPR. Unsafe recruitment practices is another issue that affects the welfare of the people we support. Not checking their DVS prior to employment and updating that record to ensure that they continue to be compliant. And not having adequate resources. Staff shortages, for example, is another way that practices can be unsafe and may affect the well-being of the people we support. The safeguarding lead or officer has the responsibility of overseeing safeguarding policies, managing cases that come up, and also providing training to make sure that everyone within the organization remains current with safeguarding policies. Providing training ensures that staff are trained and are aware of any updates on safeguarding practices. And the safeguarding lead ensures that safeguarding policies are regularly reviewed and updated, and the relevant safeguarding measures are put in place. The safeguarding procedures enables people to respond to suspected or disclosed abuse and also to report any such incidences by following the policies and procedures that the organization has in place. It also helps them to report their concerns. They know who to contact in a confidential manner. They know when to whistleblow if no action has been taken. They know how to report their concerns to their managers or supervisors immediately, verbally, and in writing. And they're able to follow up the report to see what actions have been put in place as part of their duty of care. In order to create a safe environment, therefore, it is important for recruitment to be safe, for background checks of all employees to be done and updated regularly. It's also important for training to be provided on a regular basis on safeguarding policies and procedures within the organization. It is also important to have a culture whereby promoting an environment for an individual where they feel safe, confident, and able to report any concerns that they may have, and that their complaints will be dealt with in the appropriate manner. It's also essential to work in a collaborative way with other agencies in order to protect the individuals we support by sharing information and having protocols in place to do that between agencies that have been agreed, whether checks and balances. There are actions to take if suspected abuse or unsafe practices have been reported, but nothing has been done in response to that. In a situation like this, it is important for the caregiver or the person involved to follow the organization's policies on whistleblowing by reporting their concerns directly to social services or reporting directly to the Care Quality Commission, the organization's safeguarding team, and the police, whichever is appropriate in the scenario. It is important to ensure that the people we support remain safe online. Mobile phones, tablets, and computers are very, very useful, and they are essential in our modern way of life. They are a source of entertainment. That's how we keep in touch with our friends and families and the world at large. It provides us with opportunities to join discussion forums, access information, and learn new things. However, for the vulnerable people we support, they could be targeted or be at risk of illegal activity or abuse, such as bullying, fraud, grooming, exposure to illicit materials, or something more serious like radicalization. Unlike seeing someone face to face, when using social media, people are not always who they claim to be. As support workers, it is one of our duties to support the people in our care to remain safe online. We support them to use electronic communication devices, to use the internet, to use social networking sites, and also to carry out financial transactions online. As caregivers, support workers, carers, we therefore support those in our care to take precautions online by not giving out any personal information, such as their address or their phone number, by not sending pictures of themselves to anyone unless they know them and trust them, by not opening emails or attachments from people they don't know, by being careful when chatting with people on platforms, for them not to be pressured and to be careful about what conversations they are drawn into with other people, for them to be careful when meeting people online and to make sure that they meet such people in public places. All risk assessments done. To always tell someone who they're meeting and where they're meeting and what time they expect to be back. And for them to be able to approach us should they see or read anything online that worries them, but they're not sure of. To always tell us and to report it. And for them to be careful, because if a web address does not look right or is not relevant to the content of the message that they are searching for, then something is probably wrong. In our digital age, there are risks such as cyberbullying, online grooming, and exposure to inappropriate content. So there should be measures to protect personal information and their respective digital footprint. And it is also important, therefore, for us to teach the individuals about safe online practices and digital literacy. There are, however, some common challenges and barriers to effective safeguarding. These include underreporting of the challenges and issues. There are lack of resources and cultural barriers that may be a barrier to effective safeguarding. Ways to overcome those barriers are to have strategies to increase awareness of such risks, to better train all concerned, because safeguarding is everyone's business, and also to have more resources. As I said earlier, safeguarding is everyone's business. And as a healthcare practitioner, it is important that you put your learning into practice by gaining the knowledge you need to acquire, by you identifying actions to change so that your practice can be improved, and to understand the implication for your work and how you can work differently to strengthen safeguarding for you, your colleagues, as well as your settings, and to start to practice the skill that you have acquired. In summary, continuous improvement in safeguarding is essential, and it is therefore important to have regular reviews of the policies and procedures of the organization, and this is communicated to all concerned, all the employees and stakeholders. It is important to have feedback mechanisms encouraging input to improve the safeguarding procedures and practices, and to invest in professional development so that training is ongoing and the staff continue to be developed and stay current with legislation and other policies. We have now come to the end of this training, and in summary, I have shared with you how to recognize signs of abuse and improper treatment. You should now know how to respond to suspected or disclosed abuse and improper treatment. You'd have gained now an understanding of the national and local context of safeguarding and protection from abuse and improper treatment. You now understand ways to reduce the likelihood of abuse and neglect. You know how to recognize and report unsafe practices and understand the principles of safeguarding adults. You now also understand the principles of online safety.